today, Wasun has joined Waho to
Yes.
celebrate Waho Day,
Yes.
9th July 2014.
14.
How do you see this event?
Yes, this is very historic because this is the first time such important joint working group is being organized so far I'm concerned, in Ghana. So I see it as very historic and opportunity for examining our successes and our challenges and see the way forward. It's a good partnership, I must say.
Well, thank you very much. At country level, that's the level of Ghana, you are the liaison officer for Waho.
Yes.
Where do you possibly see the collaboration between Waho and Wasun at the country level?
Yes. Waho is one of the specialized agencies of ECOWAS. And Waho welcomes all the unions that have the common goal, because the objective of Waho is to address the health challenges. So any organization that has that common goal, Waho is with them. Waho is ready to work as a partner with all organizations within. So health workers union, they are directly in health. So if there's a union in health, because they are the core players to give care to the people. So it's a welcome idea and a welcome partnership.
Yes, thank you very much. Wasun, that's the West African Health Sector Unions Network.
Yes.
Made up of about 7 sub-regional countries
now.
Wants to work closely with Waho at all levels.
Yes.
Our main focus now is to gain some recognition by Waho, both at national, the international level and the country level. Can you give us an assurance that you facilitate this process as a liaison officer so that at least Wasu will be recognized by Waho and equally be given an observer status on the committee of experts?
Yes. This is a very important move that as a liaison officer, I'm ready to champion the cause of Waho in any positive way as your organization is doing. So we are prepared to work closely with you to gain that recognition that you deserve, so that it can be a motivation for you to strive hard to work towards achieving the common goal within the West African sub-region. So we are with you and want to assure you that we will continue to work very well with you, and we work as a team within the sub-region and welcome any other organization that want to promote the common cause of Waho, which is good health for our people within the sub-region. So we want to assure you that we are with you.
And finally, can you give us some brief comments on the theme for the celebration? That is universal health coverage. As well as the issues that we are going to discuss, that is the Ebola pandemic.
Yes.
Which is, very horrifying, and it's actually
fearful.
Bringing a whole lot of stress to the people of the sub-region, and then people are scared. Can you give us a brief comment on
it? Universal health coverage was chosen as a critical topic because if you look at our sub-region, access to health care is limited. A lot of people have no access to health care. And if we are not encouraging universal health coverage, it means so many people will be left out. And the country or the sub-region is losing its talent because there are a lot of people, children, who are dying at a very young age that it shouldn't happen. And they have a lot of talent for the development of the sub-region. That is why Waho see universal health coverage as a challenge to the sub-region, and all governments should work towards it, ensure that everybody within the sub-region have access to health care, because without, if a country is not healthy, you don't have a healthy population, you cannot be productive. Therefore, you cannot develop. So it's on against this background that this topic is very critical to the sub-region at this time.
What about the Ebola scare?
Yes, Ebola has created a scare in the sub-region, and it started from Guinea, moved towards Sierra Leone to Liberia, and Waho is working closely with all member countries, the health sector within the member countries, to put measures in place so that they could prevent these diseases. Since we don't have a cure for it, the only way is prevention. And Waho is working closely with all member countries to ensure that all interventions are put in place to avert this challenge, especially Ghana, which hasn't received, even witnessed and recorded any case. There's several meetings. There's a standing committee within every country, technical committee within every country that is working closely to prevent this Ebola disease. So, and Waho is working closely with them, with WHO, Afro, and WHO. They've provided some resources and personnel to assist, especially the outbreak countries. But however, the challenge is financing. Waho is also depending on ECOWAS for subvention, and that is the challenge. So we ought to use this to urge all governments to try to scale up their resource allocation so that we can have enough funds to meet such challenges. So this is what Waho is doing, and we are hoping that this preventive measures that are being put in place will go a long way to address this issue. And we are also ready to work with all other agencies, especially health workers union, who are the core players within the health sector.
Thank you very much.
Yes, sir.